Good evening. I'd like to welcome everyone to our Board of Health meeting. It is Monday, February 10th, and it is 6:01 p.m. We'll call the meeting to order with a roll call. Stephanie Granger here, Michelle,
Here.
Megan.
Oh, you're muted.
Here.
And Stefan.
Here.
And we have Michelle is not able to make the meeting this evening. She's not feeling well.
My name's actually spelled
Joanne, I'm sorry. Joanne. Okay, so
my
we'll
name's
go
spelled
ahead.
wrong if it matters on my thing.
I noticed
it's
that. I was
spelled
going
wrong.
to
Yeah,
mention
it's
it.
A-N, right?
Yep.
Stefan. We'll go ahead and have our open forum now. And this would be for any items not on the agenda that people would have to share. Are there any?
I do not see any hands raised at this time
Okay.
or anything. Oh, wait a minute. Oh, that was Abby. Don't.
I was checking, sorry.
All right. So seeing none for that at this point, we will go ahead and go over our minutes from our January 13th meeting, which and I don't know, did anybody have any comments on them?
I didn't see anything.
I tried to set up with my 2-screen thing, but I can't do it because my son took key components with him now. So scrolling through while staring, if I look odd.
My only question was if we planned on reviewing the letters, because the wording made it sound like we were gonna review the letters written that we planned on from last meeting.
Well, okay, let's see. Where
I
is
did
that?
add the letter to the packet.
So as long as
And that
it's
is online as well,
fine.
if you want to discuss that. Yep.
Okay.
That was my only question, was just.
And I think, Megan, you're the only one that wrote a letter at this point. I have not written mine yet.
So the wording says that we were gonna review both letters at this meeting, I thought. So that was the question.
Where is that? Oh, there it is. Okay. No. Where is that? Oh, to bring to the next meeting. Okay. I think that's fine, since it doesn't say that we're going to review it, but it's on the. Anybody else have thoughts on that?
No.
Was there one about the letter I was going to write? No, I don't remember seeing anything. Megan, did you see something about the other one?
I thought I did. I'm sorry. I'm being slow in rereading the letter. Or the notes. Oh, so it just says a resident survey is being distributed. A letter will be drafted for the board to send to the town manager's office by the next meeting.
Okay. Well, maybe that was the plan, but it hasn't been done.
So either way, I just didn't know if we wanted it in the notes, that's all.
Yeah, I don't know if we had necessarily planned on it for this meeting or not, but if that's what we said. Any thoughts? Do we leave that as is, or Michelle? You've been on the board a long time. Is it fine to just
Yeah,
leave that?
I think it's fine to just leave it.
Okay. The goal was perhaps to have it done for this meeting, but it has not yet been done. Many other things have come up. So, all right. So then I think we can probably accept the minutes as is if we're good with it. Is there a motion to do so?
I'll make that motion.
Okay, motion made. Is there a second?
Second that motion.
All right, all in favor, Stephanie, I, Michelle,
Aye.
Megan,
Aye.
and Stefan?
Aye.
Okay, so that passes. Do I say unanimously for the four of us who are here? Yes, Ray, your hand is up.
Sorry about that.
Okay,
I
that was
was
an on
checking, I
purpose.
was checking the participants to see if there were any questions about the
Okay.
minutes.
All right, so that passes unanimously then. Thank you. Okay. So then Board of Health meeting schedule for 2025 is our next agenda item.
Yeah, so you can see in your packet, we put together a Board of Health meeting schedule for the 2025, just so that we're all on the same page. This really helps us set up dates. We try to give folks at least 10 days in advance notice for any variances that they want to apply for, so that we have time to review those variances before your board meeting. So this schedule not only helps you, helps us, but it helps the residents understand, how many days before a Board of Health meeting they can apply for any variance requests. Marissa put this together for us here in the office, and I did ask that she flag any holidays, but you can see is October 13th. It's certainly up to you all how you want to proceed with that. Understanding we won't be on Columbus / Indigenous Peoples Day, but we can certainly wait till we get closer to see if there's a day that works for all of you or to have a quorum, or we can look at a date now, however you want to proceed.
I mean, it's probably good to set a date now if people would like to do that. That way you can work around it more easily. We don't know though if there's going to be a special town meeting around that time, which could impact dates. So maybe given that, it is better to wait until we're closer.
Yeah, and we can certainly reach out in August, see, as we get closer, if that works for you all. Typically we do try to, hold the meeting on a Monday if possible, but, certainly open to, the 6th or the 20th is open right now. But again, we can wait till we get closer, whatever.
Right, we always have a challenge then with the special town meeting, and Columbus Day always makes that one tricky.
Mm-hmm, correct.
Yeah, if you're able then to just sort of note it like that date will change.
Okay,
for
perfect.
people who,
And as long as there's no concerns or issues or questions, no vote is needed on the schedule.
okay. Anybody have any questions or concerns? Okay, thank you.
Great, thank you.
Okay, so now we have a discussion regarding a resident's request about fluoride in town water. So this request, Ray, you shared with us that there's a resident who has requested that we remove fluoridation from town water to provide a savings to the town of $20,000.
Yes, so we did receive an email from the town manager's office that some residents had reached out, just curious with some questions regarding the cost, which does cost the town about $20,000 a year for fluoridation for our public water supply. That was enacted in 1994. Adjustments were made in 2015. Per the Department of Public Health, the Center for CDC, the Centers for Disease Control, and we did put several items in your packet that do still recommend fluoride. I did respond, I would say about a month ago when we received this email, a little less than a month ago, just saying that we would certainly look into this. We would talk about it with the board. And look into, the latest research. Certainly, I know there's been advances with fluoride treatments, but as you can see, there are 7 million people in Massachusetts, and 2 million of those folks have dental insurance. I did try to find data more specific to Westford, but from all the research that we can find and put in the packet, our department would certainly recommend fluoridization for our public water supply.
And the Massachusetts and national level is a 0.7.
Micrograms per liter, correct.
And recognize that we're a couple minutes ahead of what was scheduled for this, so I don't know if that impacts anybody who might have been planning to join the meeting. Our reason for discussing Ray was that it hasn't specifically come to us, but the thought was that at town meeting, if it was brought up, that we might want to have a position.
Correct. So I do want to get back to the residents to let them know what this board discussed, and some of them may be on tonight and may have questions, but again, certainly wanted the Board of Health per Mass General Law is required to look at fluoride and see if that's something that they would like to institute or not. We did reach out to several communities in the area to see who has fluoridated water as well as us. And I did speak with the water department. Again, they are the ones that add the fluoride, and they did not have any concerns about continuing.
This was on or before the board when I first was on the board, I guess back in 2015 or so. So it's something we've discussed before. I recall at the time several dentists coming and telling us they could tell which towns people lived in based on, children in particular, based on the state of their teeth when they would come into the dentist. I don't know if I'm thinking if there are people who would like to speak on this, maybe we should hear from them first before we continue our discussion and arrive at our position. What I would like for that is to have people speak for up to 2 minutes. Make sure that they state their name and address for the record, and please not to be repetitive. So if something that you were going to say has been said, it's been said. So I guess with that, we can maybe open
Sure.
public comment.
The first gentleman, let me let Andrew.
Yes, this is Andrew Bergamini at 78 Graniteville Road.
Welcome, Andrew.
Hello, my concern, thank you for allowing me to speak. My concern really isn't as much about the budget item, is about the health item. I challenge the statement about when we started fluoridating water, because I think we did it a lot sooner than 1994 or whatever that date was. So I think you want to go back and check your history on that. My concern is that there is much more fluoride in many more products than there used to be back then when people started talking about fluoride treatment. And in fact, if you go on the web and do some research, you'll find that almost every soft drink on the market, including Pepsi Cola and Coca-Cola, have fluoride in them. If any plant that manufactures a product like that has fluoride in the water and they don't filter it out, then that becomes part of the product as well. So there are independent treatments. If people are concerned about dental decay, or then my point to them is, well, there are treatments that you can have made if you want to be treated yourself or you want your children to be treated. My concern is, and it always has been, that my freedom of choice has been eliminated because the town has determined that everybody should have fluoride in town water. So I don't have my choice in not wanting it unless I buy auxiliary equipment to filter that out, which I do, but it's not cheap. And so the other thing that people seem to miss, and I think it's very, very important, that unless you have a complete system that removes fluoride in your water, every time you take a shower, you're being exposed to fluoride. And your skin is the biggest organ in your body, and you're absorbing that every single day. So my concern really is a health concern and a choice concern. And if you go out on the web and you start, and these are viable resources. These are not people who are just talking out of their rear ends. These are viable. In Europe, fluoride is mostly banned. Uh, and there are other countries that ban it. There are states that, or
Please wrap
towns
up.
that ban it. And so there's got to be some truth behind the concern. There's a cancer concern. There is concerns about bone density and things like that. And all you have to do is go out on the web and look this stuff up. This isn't a secret. And I would encourage you to do more homework about
Thank you. I appreciate your comments.
All right. And again, thank you for letting me speak.
Okay. Yeah, absolutely. Is there anyone else then, Ray?
Go ahead, Cynthia.
Hi, Cynthia. Please state your name and address for the record. You're muted. Ray, you have her unmuted? She's muted. Cynthia, you're muted.
Asked her to unmute. Yeah.
Okay, can you hear me now?
Yes.
Great. Okay, Cynthia King, 82 Depot Street in Westford. I'll just give you my background. I have a BS in pharmacy. I'm a registered pharmacist. I'm also a doctor of acupuncture and Chinese medicine, been practicing that for 35 years, has been a pharmacist since 1976. In the time that I was in school in the 70s, fluoride was controversial, and I actually did a research project on it. And we're seeing a lot of the duplication of the things that Andy just spoke about. But one of the things that he didn't, what I wanted to ask is, how much fluoride are we adding to the water in Westford? What's the milligram per liter?
It's up to the 7 parts.
It's 0.7 micrograms per liter, which is the state recommended level.
Yeah, so that is the recommended level. And I think what Andy's trying to say is that, we're exposed to even more of that, which can be toxic. And one of my concerns about fluoride in the water is the neurodevelopment and the cognitive ability. So it does cause dullness of the in the brain, and there's studies that show that.
I would love it if you would send me those studies.
Yeah, I can send the one from the National Toxicity
I've read that one.
Program, but I didn't research what I had done this a long time ago, and I think if people want to add fluoride, again, I think that should be their choice, not put in their drinking water. You want your kids to have supplements, fine. You want to have fluoride in your toothpaste, fine. They make fluoridated and unfluoridated. But I think there's enough written and enough studies that show some of the side effects of fluoride. And just like, I think it was last week, whether you agree or disagree or like or dislike Robert Kennedy Jr., who may end up being head of the health, cited 87 studies against fluoride. So
Okay.
I think you really need to take, and I think that,
Sorry, just
with
please
the
wrap
time-
up.
Yep. So another thing is the budgetary thing. $20,000 is a good amount of money in the town budget where you could not do that and give people the option of either doing it on their own or not. So that I'll just wrap it up with that.
Thank you.
Thank you.
Do we have some more people, Ray, or?
Not at this time.
Okay. Then, oh, and there's something in the Q&A.
If I could just add that I did do the research. I pulled every town report for the 90s. Working with the water department, they did mention that fluoride, they started adding fluoride to the public water supply in the 90s per their master plan. So I did pull every town report, and it does state in the town report that it was implemented in December of 1994.
So that was Massachusetts and Westford, perhaps a little later than a lot of towns around the country, who started, and it was pretty typical from the research I've done by the 80s in a lot of towns. So I guess, I've done some research. I don't know if any of the other board members have anything that they would like to share at this point on the thought.
I'm a primary care physician in residency in 2018. As a family medicine physician, I actually did a quality improvement project on this that reiterated all of the documents that actually Ray sent out to us, showing that this is the best dollar value for preventative health for the number one chronic disease that you see in pediatric patients is dental caries. And I think that the return on investment for fluoridation of water is something like for every dollar that you spend in doing it, you save like $38 to $40 on preventative stuff. It's like across the board amazing what this sort of affects in children. All of the studies that I've ever seen going back for many years and currently all focus on how it reduces dental caries, which has an effect on children's mental health condition as a result. When they don't have pain or dental problems, it's been shown that it affects their performance in school. And there's actually been some studies that, well, one, I also, to keep up with this, Stephanie, I went and looked into, because the newest thing that's coming out is that it does have the question of it having some sort of impact on IQs. And those studies, and actually the one that was mentioned by one of the town members has been addressed by John Hopkins, and the studies that are out there about this have been shown to be poor studies or have been rejected by peer review. And basically, there are some thoughts that it actually can do the opposite, because children don't have dental caries and do better in school. They can get further in life, and they can actually have more advantages than if they didn't have this. So I mean, I think I have a solid background and understanding on this and think that this is one of those preventative ones that actually saves you money in the long run and is a huge public health preventative measure. I hope I did not go over my 2 minutes.
Thank you, Stefan. No, that's fine. Yeah, and it's from the CDC that, and quoted in other places, that for every dollar invested in fluoridation, it saves $32 to $38 per person in dental treatment costs.
And if anyone wants to look at some of those IQ studies that have been called into question, John Hopkins, Bloomberg School of Public Health addresses those. So you can look that up, and it speaks to that one that I think I'm trying to find it right now, that the resident was addressing.
Yeah, the national
Yeah,
toxicity.
the national toxicology program that was rejected. Yeah.
Thank you. Yeah, I saw that. Did anybody else have any comments they wanted to make? Joanne let me know that she was not in favor of removing fluoride from the town water system, though she was not able to be present. Megan or Michelle, did you have anything to say?
I absolutely agree that we should continue with the fluoridation program. I think I've read a quote that the CDC says fluoridation is one of the 20th century's greatest public health achievements in creating passive public health benefits. And I'm in favor of leaving it where it is.
Thanks, Michelle. Megan?
Same. Everything that I went and we looked at stuff when the question came up, and everything that I saw in peer-reviewed article in research, and also from public health sources and CDC, the recommendations are to keep it. So I agree.
Yeah, I mean, we looked at this when I first was on the board, but I went and did research again, and I did see some of the articles that or comments that were brought up by other people, but they for example, it said that in Calgary they stopped fluoridating the water, and in Alaska, and their cavity rates increased dramatically, and they saw poor dental health in their children compared to in other places, other provinces. This is considered to, like was mentioned, the upfront costs of this are so much lower than the cost of dental results from not having it. I think, it's one of the good ones, and that the research so far out there in terms of the risks of fluoridation, the CDC did drop the rate. It used to have a range from 0.7 to 1.2, and they dropped it for everyone to 0.7 to make sure that it was well within the safe level. And I did not find anything that would make me think at this time I would do anything other than fully recommend that we continue with fluoridating the town water, that the benefits far outweigh the risks as far as is documented at this point in time. So maybe we want to take a vote so that if we're asked to share our opinion.
That would be great for the
So I would make a motion to say that the Board of Health supports the continued fluoridation of the water in the town of Westford for the
At
document.
the CDC recommendation level of 0.7.
To the recommended 0.7 part. What is that exactly, right? The 0.7. Let's see, I have it here
It's
somewhere.
either parts per million or milligrams per liter.
0.7 milligrams per liter of fluoride
I would say the public water supply, and
Okay.
I do want to let you know that a resident does have their hand raised. I don't know if you want to take that.
Oh, what time is it? I guess we can take one more comment. Oh, it's a repeat. Okay, keep it very brief then, please.
You know, I'm trying to work and I'm listening in and I'm popping back here, hearing you say that, you know, what you said and you're going to take a vote, but you asked me to send you a study. You're not even considering that.
I also mentioned I had read that study.
And, you know, one of the things, I don't know, Stephen Guppel, I know you're an MD. I don't know if you're the one that does alternative medicine or not, or it's somebody else I'm thinking of. But I don't know if you're familiar with
You need to address me, Cynthia. That's the rules of,
Huh? No,
you
I'm
have
just
to address
asking,
me.
my question is if he was familiar or any of you familiar with homeopathy, because on very low doses can affect people. In homeopathy, the more you dilute a substance, the stronger it gets. So whatever you put in the water affects people in different ways and different strengths. Even if you put in a 0.7 and a percent per liter, doesn't necessarily mean that it stays that way energetically and doesn't affect people in a physical, if you educate yourself in homeopathy.
Okay, thank you, Cynthia. Okay, sorry. So let's go back to my motion. I'm sorry, I shouldn't have done that because we did have a motion on the table. So
So is
the
that, did
Board
you,
of Health,
is the motion on the table? Can someone second it? Can I second it?
yeah, did we have it recorded there? But, okay, we've got it. Okay, so the motion's made,
I'd like to second the motion.
motion seconded, then all in favor. Stephanie, yes. Michelle,
Yes.
Megan,
Yes.
and Stefan.
Yes.
Okay, so that passes unanimously. And we can have it noted that Joanne had also made her position known on that. And I will say that I don't think any of us took this lightly. We've all done research. We've all looked at the current research as well. And you know, it is an important thing. I believe in constantly looking at the most up-to-date research and basing decisions on the science that is most up to date. So, okay, thank you guys. With that, let me turn my paper back over. Our next agenda item is the update on vacant food inspector position. And thank you, Megan, for writing your letter.
Yes, thank you very much. So I just wanted to give this board an update on the food inspector position. I know at the last meeting we did discuss the part-time status of the position. And I know there was a request for benefits. As you can see in the packet, there was a breakdown that was provided to the town manager's office of the hours that this position requires. There's a lot of nights and evening events. The position was originally a 20-hour position with benefits, and over time that was cut to 18 hours, no benefits. So we're about to advertise. Speaking with the town manager, she did offer a 19.75 increase to the position. So, excuse me, a total of 19.75 increase to the position with no benefits. So I just wanted to make this board aware and let you know that we will start to advertise.
And I guess we'll see how that goes. Wish you luck on that. And we appreciate that it sounds like actually, at least the town manager understands this would have been nice to do, but budget restraints made it difficult. How, Ray, is that going to play out in what the state is starting to mandate or looking at mandating with that study they've put out? Do we know what they're going to require?
FDA requires if you have 250 inspections per year. They need a full-time position. I don't know how it's going to pan out yet with the Department of Public Health with the new foundational public health services requirements. Right now, we do everything we can. Our health agent, myself, our assistant director, Abby, all takes a piece of food when needed, especially food inspection, especially for the evening, weekend events. The position does accrue a lot of comp time because of that. And we are utilizing a regional health inspector. I know that was a question that came up. Is there any way to share with another community? So we do share food inspection services with the public health inspector that's regional. So we are utilizing her as much as possible. She came to us on Mondays here in the health department, and she recently adjusted her schedule to help us come in on Tuesdays, which are 10-hour days. So we're utilizing her as much as possible.
And do we have the 250? Is that how many visits do we have per year?
So we have 163 establishments, and you can see, let me see if I have that in front of me. I know it was in the packet of how many hours of inspection, how many inspections and how many hours are done per year with those calculations, what percentages the other positions provide in the department. So we're short a little bit over 1,000 hours a year. With the requirements, there's a lot of new food establishments, plan reviews. You can see there's lots of aspects of the job. And I will just add that in the past, the food inspector provided what was called a food manager certification manager, which is required of each establishment, serve safe certification. And that's something that we have not been able to provide since COVID. So just like
Do
a
they
screen
then just have to get
coordination.
that done somewhere else?
Yeah. Yep. So we provide those directories to our establishments here.
Well, thank you for trying to make it happen in creative ways. Okay, our next agenda item then is, unless anybody had any questions about that. The update on the vacant regional community health coordinator position.
So we do have quite a few applications, well over 30. We are starting phone interviews this week, and we have interviews set up for the end of the month. So moving along progressively, which is great. The town of Acton, the health director of Health and Human Services, myself, BME Strategies, our consultant for shared services, are all going to be on the interview team.
Oh, great. Okay, so that you guys looked at the resumes with them and
We have looked at the resumes, yep, and our consultant is helping us set up those interviews. And we'll start with phone interviews and move to in-person interviews.
great. I'm glad that you have support in that.
Yes.
Now we have an update on the school dental program.
Yeah, so each year I just want, we always let the board know when the school dental program is beginning. That is beginning here at the end of the month. We do have our dental hygienist, Andrea, who we so appreciate her helping us and giving her time. And so this year, as you're aware, this program was cut last year. Typically, this program would be provided for K through 5. This year, with the budget restraints, it'll be K through 2. And we are using grant funds to continue that program. So they provided cleanings and screenings. I will say that we did get approval from our it was asked at the finance committee meeting if we can utilize our immunization revolving account, which provides for clinical services for the department, and we have been given approval to do that moving forward. So between grant funds and hopefully with the revolving account, we'll be able to expand the program in the future, possibly back to 5th grade again. So just wanted you to be aware that we have met with the school nurses and to make sure that they're ready to go, and if they had any questions or concerns with the program. They're a huge piece for the examination and screening and cleaning do take place in their offices. So they're a huge part of the program, and we certainly thank them. So if any parent, like I said, has a child in the public schools, K through 2, those invites have been sent to all the schools, and we'd be happy to provide the service.
Thank you, Ray.
Sure.
That's great that maybe we can expand it again.
Yes.
Okay, the next agenda item is the Foundational Public Health Services Review for Local Public Health.
The Department of Public Health, we've been asked to, a letter's been sent to the town as well as to the chair of boards of health throughout the state of Massachusetts. As you're aware, there are 351 boards of health here in Massachusetts. The Department of Public Health is launching a Foundational Public Health Services Shared Services Review. It's a 5-month initiative. It's running from January to May of this year, and it is a review to gather critical information from local public health departments and services. They're looking at a cost analysis statewide to enhance data-driven information to provide the best public health resources. So that is certainly something that our department is required to participate in, and we have begun the process. It's quite a process.
Is there
Lots of
anything
information.
that, like, I did not know what that email was about when I received it. Like, because it said the shared services thing, I was thinking it was our grant.
Mhm.
But is there anything that we can or need to be doing to support that?
At this time, it's man hours. It's man hours of looking at every policy and procedure that you have in your public health department. It's a breakdown of every position in the department and to break down exactly what percentage of everything that they do every day
So you're
year
just having to
round.
track.
And then cost analysis of what everything costs. And so, yeah, we're in the same boat as every other health department. So there's a lot of positives to the information. It's going to take time. So we'll certainly make sure you get those results when they come in.
Okay, thank you. And I'm sorry. I mean, I think it sounds like it's to a good end, but that it's a
It is.
painful
It is.
process.
It is. It's the first time this has happened in the state of Massachusetts. And I think, you know, it's really important to look at what your health departments are doing, what services they're providing, and what is it costing to have these positions, and you know, how are we going to pay for public health services moving
Are
forward?
they doing it to think about regionalization at all? Is that part of the
They
issue?
are. They are looking at shared services and how can we get creative with, you know, certainly we have lots of partnerships here at our health department, and we share services and provide shared programming. So it's a great thing. And like I said, for us, it's just, you know, it's always busy. So, right, everyone's busy. When's a good time for 5 months of data? But we're cracking at it in the background, and we'll get it done. So,
Thank you.
yep.
Stephanie, we have a question regarding the dental youth program.
Yeah, I saw that. So no, that is not the same 20,000. The 20,000 was about the amount of money that's spent to fluoridate the town water, whereas the other funding is for the dental program, and you get that from a grant, right?
So the school dental program is $3,300 a year. And that was a line item in our operating budget that was cut last year. Our senior dental program, we fundraise for that. And that helps seniors over 55 years old who do not have dental insurance in town. The 20,000 is what the town pays for fluoridation, the public water supply.
The 3,300, is that for K through 2 or is that K through 5?
That was for K through 5.
Okay, so that's about what it would cost.
And we do charge $20 a child who does have a cleaning. So we make about $1,200, a little less than half each year on that program.
Thank you. All right, so with that, we are on to old business, the update on the PFAS drinking water well project.
Sure. So as you're aware, this project is ARPA funded through the select board. Uh, we have 37 applicants, and Sam Fontaine, our health agent, has been working with Abby on this project. Today, we have just sent out the emails and notified the 37 residents who applied. There are 50 spots available, so there's still time if there are residents who have a private drinking water well who would like to have their well tested for PFAS at no cost. So we do have residents coming uh, pretty frequently now for their test kits to come in, and we educate them at the counter of how to do everything. So just wanted to give you a little update on how that program's going. The closure date ended, I believe, on Friday. So, but again, we still have some slots available if there are any residents out there that would like to reach out. You can
And
just call the
the
health
cost
department.
of doing it privately is like 400.
It is over 400. They have kept the price for us for this project. So my understanding, it has gone up higher than 400, but like I said, that's what they're honoring for this project, and it would be free for the
Right,
resident.
so free, and it helps the town have also a good picture of what our
Yeah, and
PFAS
I think
well
it gives
waters are.
the resident a sense of what's in their water when it comes to PFAS. So yeah, certainly if they're interested, they can reach out.
Great. As far as the PFAS testing map from the original 50 that we did and from the 37 requests now received, are there any areas of town that you feel are underrepresented in testing and potentially could do a mailer to those neighborhoods to see if we can
It's
get?
certainly something we can look into. I know when I spoke with Sam this morning about that, um, it is something that typically we sit down and meet with the water department to go over, you know, the round of folks that have come in and look at the addresses and what areas do we still need some information from. So we can certainly do that. But we did discuss that this morning as moving forward. How do we want to proceed with that? You know, the first round we kind of we did a quadrant, and we kind of looked at different areas of town, and as it worked out, applicants, there was a good representation for each quadrant. This time around, it was more, we let residents know we wanted to make sure that anyone that didn't make the first 50 had an opportunity, really, regardless of where you lived in town. But that is something that we will take a close look at.
You don't have an overlay for wells, correct? Or you do?
Are you talking about
Do you
on?
know all the areas specifically where people
We do.
are?
Yep.
Okay.
Yep. So, and that's public information. Anyone can see geographical information systems or maps of where many things are in town, not just private drinking water wells.
Okay, I thought at one point we discussed that you didn't have a listing for that or something. Maybe it was a way to communicate with.
Well, what we have is we don't have a specific well list with addresses here at the health department. What
Okay.
the GIS system has done, and the coordinator has worked with the water department, where there isn't a public water supply hookup, it's assumed there's a public water well.
That they
So
have
that's what
water?
we're working with, right?
Okay.
We're hoping you have water and not, using the lake or something, or a puddle or something, yeah. So,
Okay. So that would just be the slight challenge in reaching out to people, but you can tell where they are, so that's good. Okay. Yeah, so yeah, if people, that would be great if we can, if there are places we're missing, if maybe we can reach out somehow to them. And alternatives to tobacco regulation ticket? Oh, tickets, yeah.
so a couple things I did mention at the last meeting. Typically, per our tobacco regulations here in Massachusetts and our local regulations, um, when anyone is found, whether it's they have marijuana, tobacco, they're vaping, anything to that nature, they can certainly be fined at school, or found in the public. So what we see is we do see lots of students that are being fined in our schools here. Um, For me personally, working here in the health department for a long time, we're finding that parents are getting $300 tickets. You start at 100, 200, 300. Um, when you get to the 300 mark, they just keep throwing you $300 tickets. But that's not solving the problem or providing resources. So for me as health director, it's important to me that there's some alternatives, some options for kids that may want to quit. I think it's important that we provide that information for our school resource officers. We have parents that come to the counter and are desperate for any kind of program. So I am working with our community wellness coordinator here in the community, and we're going to be sitting down with the schools to see what alternatives we put a list together of all kinds of options and resources that not only are provided throughout the state, but here in Westford and in our surrounding communities. So we just went to what's called I Decide. It's a curriculum, a national curriculum to help students not only quit smoking or vaping, but different substance abuse, alcohol, things of that nature. So that's just one of 15 different, now they have, you can quit vaping, you can quit smoking via text. They have different systems here in Massachusetts. So I think it's important we provide those resources besides just a ticket. So we'll work with both the technical school and our Westford Public School with our school resource officers, school nurses, and the deans at the schools to see what options do they want to provide. Are they able to provide some of these curriculum trainings, or what do
So
they
wait,
want to
they would
offer?
need to be the ones providing it?
It depends on the resource. So there, like I said, there are free texting programs. There are other programs that are free, but in some cases they would need a facilitator. And I know for our public health schools, they do have 4 or 5, for instance, I Decide facilitator trainers. Um, you need more than one student to put on the training, which means that student that's caught has to wait till someone else gets caught before they can put on a training. So again, looking at a resource list, we're putting that together to see if we can provide that to the schools and see if that can help.
And the idea being that perhaps first or second time they would get a chance to do this instead of.
So that would, unfortunately, it's in the tobacco regulations. Those tickets have to be given. They're, as you know, they are approved as health agents of this board each year.
Mhm.
But as an alternative, whether it's, we give you $100 ticket if you sign up for this 8-week course, or, something to that effect. So I want to meet with them first to see what they feel they can and can't do. What do they want to provide? And, come back to this board. And if it turns out, maybe we make some changes to the tobacco fines, maybe we don't, maybe we just put some alternatives or options in our local regulations on top of that.
But we would be allowed to,
We
the
would, in
fines
our
are,
local regulation, we certainly couldn't do that for establishments, but we could do that in our local tobacco regulations. At this time, the school resources officers do feel the tickets help and the fines do help. But again, it would, it's one thing to give a ticket, but if, even if you're pulled over for speeding, they can send you to drive school, right? And so they send you to try to learn to change your behaviors. And so, I've had 17-year-old, 16-year-old kids at the counter who said, listen, I can't quit. I can't quit vaping. I'm trying. And they've asked for help. And so I just feel like it's our job to try to find that.
I think that's great if we can find something that would work.
Mhm.
Yeah. The problem of having multiple at the same time to set up the class becomes the challenge for something for that, but hopefully you
Yeah,
can.
and our community health coordinator, Nicole, has offered to put on some of those trainings, to get around union issues and other issues of staying after school and things of that
Mhm.
nature. So again, trying to get creative and use some of the resources that we have here in town to, help parents, help kids, kick habits if they want to quit, no one's forcing them.
It would be good though. All right, thank you. Um, had my phone silenced. Oh, but that's my husband, so it rang through. Um, okay, our next is new business. So the new medical director for the health department standing orders.
Sure. So we just want to thank Dr. Andreas. He has been our medical director for 20 plus years. He works at PD West and he's retiring. And so we wish him all the best. He signs all our standing orders here in our department for this community. So he's really been a tremendous help to us and partner. So we want to wish him all the best in his next chapter. And we want to thank Dr. James Daly. He is stepping up and taking the spot for Dr. A. And so he also works at PD West, and he's agreed to be our medical examiner and has signed our orders. So we are very thankful to him as well, and everyone at PD West. It's a great partnership. So just wanted to make you aware of that. It's important the board knows who's our medical director for our orders.
Great, thank you.
Sure.
And then the school nurse survey.
Last but not least, so as part of our strategic plan for our community improvement plan, we are required to have focus groups. Our consultant puts on focus groups with different partnerships, departments, and the school nurses are one of them. So they're the first to be surveyed to see what this department can do for them and help them, assist them. We do work closely with the school nurses on outbreaks and all kinds of clinical and medical issues throughout the year. So we do want to let them know that they have an opportunity, and it's anonymous, to provide any feedback that they have regarding this department and how we can improve services to assist them. So just wanted you to be aware of that survey that has just gone out to them.
Great. Is there any other old or new business?
I don't think so. Anything you have to add, Abby?
Okay, quiet on the septic front.
For now, until it's spring, yes.
All right, well, thank you very much. And I guess if anybody would like to make a motion then to adjourn.
I'll make that motion.
Okay, Michelle makes the motion. Is there a second?
I'll second the motion.
Stefan seconds. All in favor, Stephanie, aye. Michelle, sorry.
Aye.
Megan
Hi.
and Stefan. All right, motion passes unanimously. Thank you. And thank you so much, Abby and Ray and the department, for all you guys do.
Thank you. Have a great night.
Have a great
Thank you.
night.
Thank you. Bye.